There are moments in medicine I'll never forget, not because someone collapsed in front of me, but because weeks earlier their body had already tried to warn them and nobody recognized the signs. I think about those moments often because they remind me that the human body rarely stays silent before something serious happens. It speaks to us, sometimes in a whisper, sometimes in a nagging little discomfort we brush off on our way out the door. And too often, especially as we get older, we've learned to ignore those whispers. I'm Dr. Alan Mercer. I've spent more than 35 years caring for older adults, sitting across from them in exam rooms, listening to their stories, and yes, sometimes catching the small clues that made all the difference. Over those decades, I've noticed a pattern that troubles me. So many of my patients, wonderful, strong, resilient people, dismissed early symptoms because they blamed something else. They blamed getting older, they blamed arthritis, they blamed a bad night's sleep, they blamed indigestion from dinner, they blamed stress, or simply not exercising enough. And sometimes that explanation was exactly right, but sometimes it wasn't. Before we go any further, I want to say this clearly because it matters more than anything else in this video. This isn't meant to frighten you. It's meant to help you recognize patterns that deserve a conversation with your doctor. Most of the time, the discomfort you feel is not a heart attack. Most of the time, that tiredness really is just tiredness. But there are certain signs, certain patterns that are worth paying closer attention to, especially after 60, when our risk for heart disease naturally increases. My hope today is simple. I want to give you the knowledge to tell the difference between an ordinary ache and something your heart may be trying to tell you. Let's walk through this together, the way I would with a patient I care about. Before we talk about the signs themselves, it helps to understand a little about what's happening inside the heart as we age. Over many years, the arteries that feed the heart muscle can slowly narrow. This happens through a process called coronary artery disease, where fatty deposits, something doctors call plaque, build up along the inner walls of the arteries. Think of it almost like mineral buildup slowly narrowing a garden hose. At first, enough water still gets through. But over time, the passage becomes tighter and the flow becomes more restricted. When the heart muscle doesn't receive enough oxygen-rich blood, it sends out distress signals. Sometimes those signals are dramatic and unmistakable, but very often, especially in older adults, especially in women, and especially in people with diabetes, those signals are quiet, subtle, easy to miss. That's exactly why I wanted to make this video. Now let's talk about the first warning sign, one that most people already associate with heart trouble, but which often shows up in a much gentler way than the movies would have you believe. The first sign is pressure, tightness, or discomfort in the chest. When people imagine a heart attack, they picture someone clutching their chest in agony, collapsing dramatically. And sometimes that does happen. But far more often, especially in the days or weeks leading up to a cardiac event, the discomfort is far more subtle. It might not even feel like pain. It might feel like heaviness, like someone is resting a hand on your chest. It might come and go, appearing for a few minutes during activity and fading when you rest. It might not even be located in the very center of the chest, but slightly off to one side. I remember a patient of mine, a 72-year-old man named Walter, who came in for what he thought was a routine visit. Almost in passing, he mentioned that for the past 2 weeks, he'd been having this strange tightness after meals. He assumed it was heartburn, something he'd dealt with on and off for years. He'd been taking antacids, and sometimes they seemed to help a little, which reinforced his belief that it was nothing more than indigestion. But something about the way he described it caught my attention. It wasn't a burning sensation. It was more like a squeezing, a pressure that came on with exertion, like walking to get the mail, and eased when he sat down to rest. That pattern, discomfort with activity, relief with rest, is one of the most important clues in cardiology. We ran some tests, and it turned out Walter had significant narrowing in one of his coronary arteries. He underwent a procedure to open the blockage, and today, he still jokes with me that his heartburn turned out to be the most important heartburn of his life. Why do so many people, especially men and women in their 60s, 70s, and beyond, dismiss this kind of discomfort? Part of it is generational. Many older adults grew up with a mindset of pushing through pain, not wanting to make a fuss, not wanting to bother anyone with what might turn out to be nothing. Part of it is simply familiarity. If you've had heartburn before, it's natural to assume that a similar sensation is the same old problem. And part of it is fear, an unspoken worry that if it really is something serious, they'd rather not know. I understand all of these instincts, but I want to gently encourage you to let go of that last one. Knowing early gives you power. Not knowing takes that power away. If you experience chest pressure, tightness, or discomfort that lasts more than a few minutes, that comes and goes with activity, or that feels different from anything you've experienced before, please don't wait it out. Call your doctor, or if it's severe, seek emergency care. The earlier this is caught, the better the outcome tends to be, and most people who get evaluated quickly go on to live full, active lives. The second warning sign is shortness of breath during normal activities that never used to leave you winded. This one is tricky because as we age, it's natural to feel a little more breathless than we did in our 30s. But there's a difference between the gradual, mild changes of normal aging and a noticeable new difficulty catching your breath while doing something as simple as walking to the mailbox, climbing a single flight of stairs, or even making the bed. When the heart isn't pumping as efficiently as it should, whether because of narrowed arteries, weakened heart muscle, or another underlying issue, the body compensates in various ways, and one of the earliest signs can be breathlessness. The heart simply isn't delivering oxygen-rich blood to the muscles and tissues as effectively as it once did, so even mild exertion can leave you gasping in a way that feels disproportionate to the activity. I think of a patient named Louise, a woman in her late 60s who prided herself on her independence. She lived alone, kept an immaculate garden, and had always been active. Over the course of about a month, she noticed that simple household chores, vacuuming, changing the sheets, carrying laundry up the stairs, left her unusually short of breath. She chalked it up to being out of shape, telling herself she needed to get back into her walking routine. But when her daughter visited and noticed her mother pausing to catch her breath after just a few steps, she encouraged Louise to get checked out. It turned out Louise's heart was not pumping at full strength, and further testing revealed a blockage that had developed gradually over time. With treatment and some lifestyle adjustments, Louise regained much of her stamina, and today she's back to tending her garden, though she's much quicker to schedule a checkup when something feels off. The lesson here isn't that every bit of breathlessness means heart trouble. Deconditioning, being a bit out of practice with physical activity, is common and very real. But if you notice a distinct change, especially if it happened over days or weeks rather than gradually over years, and especially if it's paired with any of the other signs we're discussing today, it's worth mentioning to your doctor. The third warning sign involves pain that doesn't stay in one place, pain that spreads or radiates to the left arm, the right arm, the jaw, the neck, the back, or the shoulder. This phenomenon is called referred pain, and it happens because of how our nervous system is wired. The nerves that carry pain signals from the heart travel along pathways that are shared with nerves from other parts of the upper body. When the heart is under stress, the brain sometimes has difficulty pinpointing exactly where the discomfort is coming from, so the pain seems to appear somewhere else entirely, or in multiple places at once. This is one of the reasons heart attacks are so often missed or misunderstood, because the person experiencing it may have no chest discomfort at all, only an ache in the jaw that feels like a dental problem, or a nagging pain between the shoulder blades that seems more like a muscle strain from yard work. I've had patients come in worried about a toothache, only for us to discover the real issue was cardiac in nature. I've had others describe a deep ache in the left shoulder that they attributed to arthritis, when in fact it was their heart sending a signal through a shared nerve pathway. If you experience new, unexplained pain in the arm, jaw, neck, back, or shoulder, particularly if it appears alongside exertion or seems to come in waves, please don't assume it's simply a muscle strain or dental issue without at least mentioning it to your doctor. It's always better to ask the question than to wonder later if you should have. The fourth warning sign is extreme, Unexplained fatigue, a tiredness so deep and overwhelming that it doesn't match your level of activity and doesn't improve with rest the way ordinary tiredness usually does. This sign is especially important for women to know about because research has shown that women often experience heart attacks differently than men, and profound fatigue is one of the most commonly reported symptoms in the days or even weeks leading up to a cardiac event. When blood flow to the heart is reduced, the entire body has to work harder to compensate, and that extra effort can leave you feeling utterly drained even after a full night's sleep. This isn't the kind of tiredness that a nap fixes. It's a bone-deep exhaustion that can make even small tasks, like getting dressed or preparing a meal, feel like climbing a mountain. I recall a patient named Dorothy, a 68-year-old retired teacher who came to see me because she simply didn't feel like herself. She wasn't in pain, she didn't have chest tightness, she just felt exhausted all the time for almost 2 weeks. She'd assumed it was a lingering cold or perhaps just the natural fatigue of getting older. But something about how persistent and unusual it was prompted her to make an appointment. Testing revealed that Dorothy had experienced a small cardiac event, one without the classic chest pain most people expect. Because she came in when she did, we were able to start treatment and prevent a more serious event down the road. Fatigue is such a common complaint, and of course it can be caused by countless things that have nothing to do with the heart: poor sleep, anemia, thyroid problems, even simple overexertion. But if you notice a sudden, unexplained shift toward overwhelming exhaustion, particularly if it's new and persistent, it deserves attention rather than dismissal. The fifth warning sign is a cluster of symptoms that are frequently mistaken for a stomach problem: cold sweats, nausea, and a sensation that feels a lot like indigestion. This is one of the most misunderstood warning signs because so many people, and even some healthcare providers in the earliest moments, assume these symptoms point to something dietary rather than cardiac. Here's why this happens physiologically. The heart and the digestive system share overlapping nerve pathways, similar to the referred pain we discussed with the arm and jaw. When the heart is under strain, it can trigger nausea and a churning, uneasy feeling in the stomach that mimics food poisoning or a bad case of indigestion. Cold sweats often accompany this because the body's stress response kicks into gear, releasing adrenaline that causes sweating even when the room isn't warm and you haven't been exerting yourself. I think of a patient named Raymond who came into the emergency room convinced he'd eaten something that disagreed with him at a family barbecue. He had nausea, he was sweating profusely, and he felt generally unwell. It was actually his wife who insisted they go to the hospital rather than wait it out at home, and that decision likely saved his life. Testing showed he was, in fact, having a heart attack, one that presented with almost none of the classic chest pain symptoms. If you experience a sudden onset of nausea, cold sweats, and stomach discomfort that feels different from your usual digestive troubles, especially if it comes on without an obvious dietary trigger, please take it seriously, particularly if you also notice any shortness of breath or unusual fatigue alongside it. The sixth warning sign is sudden dizziness, lightheadedness, or a feeling like you might faint. When the heart isn't pumping effectively, blood flow to the brain can drop, even briefly, and this can produce that woozy, unsteady sensation many people describe as feeling like the room is tilting or that they might lose their balance. Some people describe it as almost feeling like they're going to black out, even if they never actually lose consciousness. Dizziness has many possible causes: dehydration, inner ear issues, blood pressure medications, or simply standing up too quickly. But when dizziness appears suddenly, without an obvious explanation, or when it's accompanied by any of the other signs we've discussed, chest discomfort, shortness of breath, nausea, it's worth taking seriously. The brain is remarkably sensitive to even small changes in blood flow, and this sensitivity can make dizziness one of the earlier warning signs your body offers. The seventh and final warning sign we'll discuss today is perhaps the most deceptive of all: symptoms that come and go over the course of several days. This pattern is associated with something called unstable angina, a condition where the heart is receiving less blood flow than it needs, often because of a partially blocked artery, but the blockage hasn't yet caused a complete heart attack. What makes this pattern so dangerous is precisely its inconsistency. A person might feel chest tightness on Monday, feel completely fine on Tuesday and Wednesday, and then feel that same tightness again on Thursday. Because the symptoms disappear, it's easy to convince yourself that whatever caused them has resolved on its own. But I want to be very clear about something important. Symptoms disappearing does not always mean the underlying problem has disappeared. In many cases, this fluctuating pattern is actually a sign that the situation is unstable and could worsen without warning. This is one of the patterns I most want you to remember from this video, because it's the one most likely to be dismissed. Now, as we talk about all of these warning signs, I want to step back for a moment and remind you of something important. The goal of this video isn't to make you fearful every time you feel a little tired or notice a passing ache. Most episodes of chest discomfort are not a heart attack. Most fatigue is not cardiac in nature. Most dizziness has a simple, harmless explanation. The human body produces all sorts of ordinary aches and sensations that mean nothing serious at all. But certain patterns, especially when they're new, unexplained, or occur alongside other symptoms, deserve prompt evaluation rather than automatic dismissal. It's also worth understanding some of the underlying risk factors that make these warning signs more significant for some people than others. High blood pressure puts extra strain on the heart and arteries over time. Diabetes can damage blood vessels and, interestingly, can also blunt the nerve signals that would normally produce pain, which is part of why heart attacks in people with diabetes sometimes come with fewer obvious symptoms. High cholesterol contributes directly to that plaque buildup we talked about earlier. Smoking damages the lining of the arteries and accelerates narrowing. Sleep apnea, which causes repeated drops in oxygen throughout the night, places ongoing stress on the cardiovascular system. Chronic stress keeps the body's fight or flight response activated more often than it should be, which affects blood pressure and heart rhythm over time. And family history matters too, because genetics can influence how our arteries age, regardless of lifestyle. The encouraging news is that so many of these risk factors are within our ability to influence. Regular movement, even gentle walking, strengthens the heart muscle and improves circulation. A diet rich in vegetables, whole grains, lean proteins, and healthy fats supports healthy cholesterol levels. Staying well hydrated helps maintain healthy blood volume and circulation. And taking prescribed medications consistently, exactly as your doctor recommends, whether for blood pressure, cholesterol, or diabetes, plays a critical role in protecting your heart over the long run. None of this requires perfection. It simply requires attention and consistency. Now, I want to walk you through something that I consider one of the most important parts of this entire video, because knowing when to act quickly can make an enormous difference in outcomes. Please call emergency services immediately if you or someone you love experiences chest pressure that lasts more than a few minutes and doesn't ease with rest. The same is true for chest pain that goes away and then returns. Pay close attention to pain that spreads into the arm, jaw, neck, or back, especially when paired with other symptoms. Severe shortness of breath, the kind that makes it hard to speak in full sentences, is an emergency. So are cold sweats appearing suddenly and without cause, sudden nausea that comes out of nowhere, and, of course, any loss of consciousness. I want to be very direct about one thing. If you or someone near you is experiencing these severe symptoms, please call emergency services rather than driving yourself or having someone drive you to the hospital. I know it can feel faster or less like a big production to simply hop in the car. But paramedics can begin life-saving treatment the moment they arrive. They have direct communication with the hospital, so the emergency team is prepared before you even walk through the door. And if something changes suddenly during transport, they are equipped to respond immediately. Every minute matters when it comes to the heart, because the longer blood flow is restricted, the more heart muscle can be affected. Acting quickly isn't about panic. It's about giving yourself or your loved one the very best possible outcome. I also want to gently remind you that heart attacks don't always announce themselves with warning signs at all. Some happen suddenly, without any preceding symptoms whatsoever. This is precisely why regular checkups, monitoring your blood pressure, keeping track of your cholesterol, and having honest conversations with your doctor about your risk factors matter just as much as recognizing symptoms in the moment. Prevention and awareness work together, hand in hand. As we come to the end of our time together today, I want you to think about what truly matters in your life: your independence, the ability to move through your days on your own terms, the relationships you cherish, the family gatherings, the time spent with grandchildren, the small everyday moments that make up a meaningful life. Every one of those things depends, in some part, on taking care of this remarkable organ that has been beating steadily since before you were born, quietly working on your behalf every single second of every single day. Recognizing these warning signs isn't about living in fear. It's about honoring your body enough to listen when it speaks to you, even in a whisper. It's about giving yourself the same care and attention you've spent a lifetime giving to the people you love. Early recognition truly does save lives, and I have seen that truth play out again and again over the course of my career. I'm Dr. Alan Mercer. Thank you for spending these moments with me. Take good care of yourself, and I'll see you in the next video.